Before the doors opened at this clinic in southeast Washington, D.C., hundreds were already in line to get tested.
It's been extremely hard. I mean, lines have been wrapped around the corners.
Dondrea Hill says she arrived an hour before, hoping to secure a PCR test. Her daughter and granddaughter tested positive last week. Now she and another grandchild have been exposed.
They got it from school. I just don't think that they have the proper system in place. I mean, I know they can't watch every child, but it's dangerous for our children, I think.
Now all she can do is wait for a result.
I'm just sick of COVID.
You're just tired of all of this?
Sick of COVID, yes.
The hours-long testing lines we're seeing here are similar to what we're seeing across the district and around the country, and it's people of all ages. D.C. Mayor Muriel Bowser is responding by opening up more PCR testing sites and ordering 1 million rapid tests, but they won't be here until January. But some worry the threat is already here, as the highly contagious Omicron variant spreads at an alarming rate. In the last 5 days, D.C. has reported more than 11,000 positive cases of coronavirus, more than the city has ever seen.
My brother was around somebody that had a COVID, and I just want to be, and I had some symptoms, so I want to make sure I don't have it.
The variant now targeting the vulnerable, hospitalizations ticking up in some areas, largely among the unvaccinated and the young. Nearly 2,000 kids have been hospitalized nationwide in the last 4 weeks, rising at a rate nearly twice as fast as adult hospitalizations. In New York City, pediatric hospitalizations have increased nearly fivefold since the start of December. Approximately half of those admitted are children under the age of 5. The state's health commissioner sounding the alarm.
Many people continue to think that children don't become infected with COVID. This is not true. Children become infected and some will be hospitalized. The immunization coverage in this group, the vaccination coverage, remains too low.
In New York, just over 16% of the children who are eligible, ages 5 to 11, have received the vaccine. And at Texas Children's Hospital, unvaccinated children in that age group filling beds. The number of COVID patients quadrupling in just the past week.
I think the majority of them that are admitted are kids that are in respiratory distress. You know, they need oxygen, or they may need assistance with breathing, just like our adult patients do.
Dr. Stanley Spinner urging families to wear their masks, avoid large crowds, and most importantly,
the absolute most important thing, and I would tell parents, number 1, number 2, number 3, number 4, number 5 down the list, is get your kids vaccinated.
And Gary joins us now from a testing site in Washington, D.C. Gary, as you reported, health officials are concerned about these cases among children, but there's also growing concern about another issue, that the number of infections could actually be much higher than reported.
Yeah, that's right, Aaron. Well, there's a line of people waiting in a PCR testing line behind me. The increase in popularity of rapid at-home tests has also been taking place, but many states don't have the reporting capabilities to be able to receive these positive cases, leading to what is likely a massive undercount in already high case numbers. Aaron?
Gary Grumbach in Washington tonight.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.